Andrew Davey with Nevada Forward, and we're here with Congresswoman Jacky Rosen. Thanks for joining us.
Thanks, Andrew. It's good to be here.
So first off, we just completed a tour of the U.S. Vets facility here in Las Vegas. What are your takeaways?
My takeaways is that the vets are lucky to have such an amazing organization and an unbelievable staff of caring, committed people who are just trying to make their experience so much better, to try to take them off the streets, get them the kind of treatment or help they need so they can transition into a full and productive life, whatever that means for each and every family.
Now, this facility receives some federal funds. Are you concerned about what might happen after August recess once Congress has to start putting together a budget for next year?
Well, I can tell you that I'm on Armed Services. I sit on the Military Personnel Committee. I will say a huge percentage of people on the Armed Services Committee are veterans and on military personnel, so they know what it feels like to transition. They care deeply about active duty military and our veterans, and we're going to do everything we can to fight for the resources that our active duty military and our veterans deserve. They protected our freedom, they protect our way of life. We need to be sure we do right by them.
Now, last week, the U.S. Senate narrowly rejected the latest version of Trump Care. Donald Trump has said he wants to continue pushing to repeal the Affordable Care Act. What do you think Congress can realistically do in terms of improving the Affordable Care Act, keeping it running?
Well, I think there's quite a few things we can do. We can talk about negotiating drug prices, number one, to get the cost up, because costs and high premiums are a huge issue. We can talk about repealing the medical device tax, the Cadillac tax. We can also talk about being sure that we take care of the marketplace. I'm part of I've signed on to the bill for Marketplace Certainty Act that's going to be sure that those cost-sharing reductions are in place. We know that uncertainty creates confusion. Insurers are going to pull out of those markets, so we can be sure we bolster that up. And we can be sure that the other thing we need to do is improve on the public option that allows people all across the country to buy in to a health care plan wherever they are. This is going to help our rurals, our smaller communities. Again, it's going to shore up the marketplace till we find some solutions going down the line.
And then finally, once Congress gets back from August recess, what do you want to do? What are you hoping Congress gets done as they get back to work? And what are you hoping Senator Heller and the rest of the Nevada delegation can do to deliver some results for Nevada, including our veterans here?
Well, Senator Heller has been wrong time and time again on the health care bill. He's voted over 20 times to repeal with no replacement, with no consideration for hundreds of thousands of Nevadans. And so I don't think that we can trust him on what he's doing, because he is just waffling every single day on what he thinks is true or not true, what he believes or what he doesn't. So what I'm going to do is I'm going to go back, I'm going to work in a bipartisan way. I'm part of a Problem Solvers Caucus. We're trying to get people to the table to talk about these issues. I always say that disease is a bipartisan predator. It doesn't care if you're young or old, black or white, rich or poor, and it sure doesn't care if you're Democrat or Republican, because a diagnosis can change your life in an instant. So what we need to do is all come to the table to fight the things, the high cost of premiums, figure out how we fix that so Americans can stay healthy, because when we're healthy, we're more productive and we're more secure as a nation. Nothing's more important than that.